Hey guys, it's Dr. John here with Paramount Health Chiropractic. I'm going to break down a research study that I was looking over today. I'm actually on high blood pressure, so I'm sure you guys all know somebody or you personally suffer with high blood pressure. Statistically, 70% of people that are hypertensive, meaning they have high blood pressure, require 2 or more medications to regulate that blood pressure. So not just you have high blood pressure, you're actually on 2 or more medications. There's obviously side effects to those as well. So this study's on chiropractic and high blood pressure. A lot of people have no idea that it can actually do anything for that. So this research study, there's an MRI study that showed 90.5% of people who had hypertension, so they had high blood pressure, they had compression between the vertebral arteries and its branches and the brainstem itself, okay, the lateral aspects of the brainstem. So vertebral arteries, so the arteries that can supply blood to the vertebral column. Then your brainstem extends down through this top bone in your neck, so the lateral branches of the brainstem. So this study, they're looking mostly at atlas, the upper cervical area, where that misalignment can actually put pressure on the brainstem mostly itself. So this was a study done on 50 people. They split them up into groups of 25. 25 had a sham adjustment, so they pretended to adjust them. They didn't actually deliver a specific neurologically based adjustment. And 25, they adjusted, and they actually found that the primary misalignment in those 25 that was adjusted came up in atlas. It was lateral atlas most often, okay? So what they saw in the change of these people, systolic blood pressure, so on average, the systolic blood pressure dropped 14 points, and the diastolic dropped 8.4 points. So a huge change in that blood pressure and that overall function of your body. They did not find any change in the pulse between the sham and the upper cervical adjustment, so there was no statistical importance of that, the pulse change. But systolic and diastolic. So huge change. People are taking many medications for many different things. Blood pressure is one of them. So if you take your time and properly analyze that nervous system and find the primary misalignments, get the body functioning better, you can absolutely see a ton of improvement in that area. So if you know anybody suffering from something, they'd like to get off some of their medications, they're taking a handful of medications every day, send them our way. We can get them assessed, see if it is truly neurologically related, see if they do have misalignments in their upper cervical area, and we can get those addressed, get them functioning better, feeling better off their medications, functioning the way they're supposed to. All right, you guys have a great day, and I will talk to you guys later.